I guess we can get started. Good morning, everybody. Thank you so much for joining us today. My name is Shreya Koirala. I am the Public Health Program Coordinator for Hepatitis B Foundation, and I also help manage Hep B United. So excited that all of you could be here today. Uh, in this warm morning, somewhat smoky for me in Minnesota, but it is what it is. Before we start, a couple of housekeeping things. As you can see, all the attendees are on mute. If you are not on mute, please kindly put yourself on mute. We do have a chat button. Please feel free to introduce yourself. We would love to know your name, your organization, and what you hope to learn from today's webinar. We also do have a question and answer button. During the webinar, anytime you have a question, please share that with us. I'll let our speakers know what questions you have after the presentations are over. The session today is being recorded. We will share the slides and we will share the recording with you in the next couple of weeks. It is my absolute pleasure to be joined today by Frank Hood and Chibo Shinagawa. Frank is my colleague and boss and the Associate Director of Policy and Partnerships for Hepatitis B Foundation. He is also the Director of Hep B United. It's been a pleasure for me to work with him and support his vision on running Hep B United for the past year, and I'm sure he has a great deal of information to share with you all. Chibo, I had the pleasure of working with her very closely in the past year. She is the Senior Program Manager of Infectious Diseases for Association of Asian Pacific Community Health Organizations, and they also have their coalition TB Elimination Alliance. They have been doing some very incredible work, and I'm excited to learn what she has to share today with us. We're going to move into presentations with Frank presenting first and then followed by Chibo. Once the presentations are done, we will take questions from all of you and we'll move to a Q&A session. Without any further ado, I'll let them get started. Take it away, Frank. And I'm going to stop sharing.
Thank you very much. Thank you for that introduction, Shreya, and it is a pleasure to work with you as well, and with Chibo. This webinar is an exciting one for us because we're all very passionate about the coalitions that we serve. So as Shreya said, my name is Frank Hood, and within the Hepatitis B Foundation, I am the Associate Director of Policy and Partnerships. That means I'm often the go-between between our organization and a lot of policymakers to help them understand, kind of what hepatitis B is, as well as going out and finding those coalitions and other organizations doing the type of work that we do, or work that is sort of supportive of our work and vice versa, and see how we can fold them into the work either the foundation is doing or the coalition is doing. And to really understand how the Hep B United Coalition started is to understand kind of how the Hepatitis B Foundation started. So just over 30 years ago, the Hepatitis B Foundation started when Dr. Tim Block, who was researching the herpes virus, had someone close in his family be diagnosed with hepatitis B. So he and his wife decided to go on this mission to really cure hepatitis B. They found, though, in that process of trying to support this individual, that there just wasn't the resources, the treatments, really the good diagnostics, education, the patient support network, so on and so forth. And so they really worked to build it. Dr. Block moved his research into hepatitis B. They reached out to folks who were familiar with the disease, including Dr. Baruch Blumberg, who was a Nobel laureate for his work on hepatitis B, discovering it, and therefore the test and vaccine for it. And with that, really set forth on this medical research mission. But with that, really found along the way all of the other pieces that were lacking, the public health policies, the fact that those who were working on hepatitis B weren't talking to others, and the fact that patients really had nowhere to go. So the foundation over the years has worked to build a consult line to help patients, has done a lot of capacity building and webinars and other great policy things. But one of its biggest achievements, and the thing that the foundation partnered with AAPCHO on, Chibo's organization, was the Hep B United Coalition. So I will share my screen because with this, as they're going through their work, and they're realizing there needs to be this ability for the folks doing the work on the ground to come together, as well as to help those folks doing the work expand their work, whether that is to build coalitions of their own or get the latest and greatest in education. So with support from the HHS Office of Minority Health and in partnership with AAPCHO, we launched this coalition that I am happy to have taken over director for just over a year ago. And it was thrilled to work with in my 6 years prior working in the infectious disease space in viral hepatitis. Kind of adjacent to Hep B United, and got to see all the great work the partners were doing. So now to get to work with them on a day-to-day basis is really great, because this coalition really has like a symmetry, a mission that is very symmetric to the mission of the foundation. And so the foundation wants to cure hepatitis B, and the mission here of the coalition is to reduce the health disparities associated with hepatitis B, to help, all the steps along the way, to bring the fact that a third plus of individuals living with the disease in the country are unaware of it, to like help raise that awareness, to help increase the number of infants and adults that are vaccinated. But all of that takes, I don't want to necessarily say hand-holding, but a personalized approach on each part of in each community in the country. And oftentimes the best people to serve them are the health centers and those in that community. But they need help. They need to know like what is the latest and greatest from elsewhere. And so this coalition exists to help link them together and to help link the answers to the questions that they have. So we're to give this example of coalition building, or we're to give this kind of coalition building one-on-one via an example of our programs. And so I wanted to frame some of the just general coalition building goals. And I should preface this. You're gonna hear me geek out about Hep B United, and I'm quite in love with it. But prior to my work here in Hep B United, I've been a grassroots organizer in some way, shape, or form for basically my entire career, advocating. I shouldn't say advocating, like engaging with individuals on the ground and connecting them with their improving capacity or whatever the issue may be. I've worked in labor, but mainly focused in healthcare in some way, and really in the infectious disease space for the last 7 years. But with that and that passion I had for it, I did go and get a master's in political management that specifically focused on nonprofit, sort of like lifting a nonprofit coalition or grassroots organization, from like starting point into existence and growth. And so I do bring some textbook learning to this work, and often don't talk about my education, but wanted to flag it here just to say that, please do hear what I'm saying, but realize that it's not just coming from my personal experience, but also from some from the books that the other experts have pointed and teach. So really, when you're looking at coalition building, you're building kind of three things. You're building your growth or your size. You're building your community, and you're building your capacity or your impact. You really aren't a coalition if you're just sitting there yourself. You're a coalition of one, so you have to grow. You have to be 1+. But if you're just like sitting there on your phones, you're not really a coalition. You're just two folks sitting on your phones. But when you're having a conversation and coming together and trying to figure out where your shared spaces are, where your shared goals, what it is, how you want to interact with one another and spend your time, now you're building community. And now that you've built the space and you're having this conversation, you decide to be like, all right, let's go do something. But how do we do it? You build your capacity or your impact. And so that could be educating, that could be maybe raising money to buy like a system. I mean, whatever it might be, you're building capacity or impact. Taking a look at my notes. So to give an example, sorry, I'm making sure, okay, it's still screening. Okay, so how do we as Hep B United grow? And to know how we grow, I guess you should know, how do you become a member? And we'll actually give you a chance to like ask questions about membership after this, but Hep B United exists as a coalition of coalitions, which means to be a member, you should be an active coalition focusing on hepatitis B or their impacted communities in your local area, whether that is a city, a state, and then we do have some national partners. So if you are working on hepatitis B or in a community that is impacted by hepatitis B, and you are actively bringing people together in that community, you're a coalition and you can become a member. And the reason that it's sort of that low barrier is because we are a coalition that is supported by the federal government. It started with HHS, but we are now funded by CDC. And so that funding we spend to go and take the time to talk to potential members to keep our website up. Actually, I don't think the website's funded by them, so scratch that. But it is funded, it helps fund our mini grants program and many of our capacity building. But we're now a coalition. We have members. Let's make sure other people can join us and that people know we exist and that who we are. And so I point out our website because I think one of the important things about being a coalition or existing is having people know you exist. So we exist. You can find us on the website or on the internet. And we want you to know, be able to easily figure out who our local partners are. So look, our 14 nonprofit national partners are right there listed. Here's our 27 states that are represented. Let's click into one of them. California has one of our highest number. And then you can go in right into each of our members. So if you're like, oh man, Hep B United seems kind of cool, like, oh, local partners, hey, I know the Asian Pacific Health Foundation. All of a sudden, this person out in the ether who HBU has never interacted with has a positive view of us because they see that we are supporting someone they know. So we ask folks to, we're these coalitions out there, we find them, we ask them to join. Finding them can be interesting. I'll talk to that in just a second, but joining is easy. There isn't a cost involved. We ask them to fill out this form right here, and it's really just basic information. What type of organization are you? What's your structure? And then to give us, we're asking for mission statement and other things, but if you are an active coalition or organization that's building coalitions, you've likely thought this through already, so it's kind of a copy or paste. And then you see down here, what your activities are. And then on others kind of where we have coalitions that will come to us who are long established in the community for years and years and years, focusing on one health issue or another, who then recognize through that work that their community is being impacted by hepatitis B, or hepatitis B is becoming a bigger issue in their community, and they reach out to us. And so they can have the infrastructure to kind of do all these other pieces, but not necessarily the know-how. And we'll want to bring them in as a member in that instance because we're here to help. We're here to bring that know-how. And the fact that they can bring infrastructure and serve their community in that way makes it a win-win for all and is really the purpose of us existing. So these folks come in, they fill out this form, they get a fun, friendly conversation with me. If you haven't figured out, I love bringing in new members. It's a really fun conversation with me. And as part of that conversation, I try to sort out who they know that might be helped by what we have as well. We also try to figure out what sort of capacity building programs would be best for them. And really, like, that is how membership happens, is us asking others who are our members to bring in folks, or as folks engage with the coalition in some other way through our resources, or engage with the foundation. So I have a conversation tomorrow, and I had two last week with folks representing their organizations that are, or coalitions that are likely to or could become members of Hep B United. They'd be great additions that connected to me through a different staff person in the foundation, because they were coming in for a very specific answer to a very specific question that we happen to have like way over here. And a colleague of mine was like, multiple colleagues of mine in different instances were like, these folks, I didn't see them on the website. It doesn't seem like they're members. They seem like they could be good ones. And that email to me could very much result in a great wave of impact down the road. The next piece I wanted to show is, so your coalition, you exist, you have to build your space. So to build that space, you need to build a sense of community. And we are a national coalition trying to make an impact on local communities, and need to have a connection to folks all the way up in the federal space, all the way down to the very local spaces. So a lot of it is virtual, but we try to bring people together how we can. First off is our listserv. Almost 200 members. Each member can post, and we use it through Google Groups. It's free. We do have a kind of a list of guidelines. It's very simple, just like be professional, that sort of thing. And it has some solid engagement. And even if there aren't folks necessarily sharing a lot, when we share something out on it that needs action, people respond. We have a monthly hour-long coalition call. We usually have, like I said, it shows here 25 to 40 attendees. We try to bring in an outside speaker to give a presentation. Sometimes we use this for an opportunity for partners to present work they're working on or need feedback on. We will also promote our capacity building programs and other things. And this is on Zoom. It isn't free Zoom. It's like the cheapest level Zoom, just so we have more than the 40 minutes or the cap. We send out a newsletter every other week, or no, sorry, twice monthly, the first and third week of the month. That subscriber list, which is a little bit broader, because it isn't just coalition members, it's also those kind of working in the space. More than 1,600. We also heavily promote all of our coalition building and stuff on there, and that's through constant contact. And I don't know the cost on it, but I do know that like you could go use a free version through MailChimp if you wanted to. And then we do one of our single biggest expenses in terms of like bringing all of our people together is our annual summit. And I'm in the midst of putting it together right now. It's going to be next month. But this really is so we can get everyone in the room, and it is so they can be talking to each other, so we can be talking with them, so we can bring in experts, our federal partners, so on and so forth, to really have robust conversations and educations. I mentioned as part of community, you need to have your shared goals, and how the Hep B United Coalition does that is a strategic planning process that it updates every few years. We just did ours last year. We publicly post those on the website, but just our goals of the coalition here: raise awareness, prevention, and intervention. And if you go back, and I actually did this last night just to refresh on it, because it'd been since I had read it, but if you go read our 2014 strategic plan for HBU, one, you'll see how far we've come, which is just fantastic. And two, it really shows just how the focus on this coalition has been singularly on this issue and hasn't strayed. And I think that's really important. Having those strategic plans are great to be able to go back and benchmark your success. And then I'm coming up on my last minute, so I will go through this quickly, but you are a coalition. You're existing, you're a coalition, you've built a community, you've built your goal, you want to go and solve that goal, you want to meet it, whatever it might be. So you gotta like build up your strength. And in our instance here, that's capacity and impact building. More than half of the funding we receive federally goes right back out the door in the form of capacity building through like helping fund peer mentorship, helping fund our mini grants program, helping fund our learning collaborative and Be Informed series, which is on the next page. So all these different ways of either by providing expert education or providing like pass-through cutting checks, to the field, we're really just trying to spread what is needed by partners doing the work. Coalitions, we are a very lucky coalition to be able to have the capacity to give these sort of foundational, impactful funding out the door. But I want to talk about each of these really, really quickly to say that you don't have to have federal funding to necessarily have some of the impact like this. So mini grants, you can find other funding, but mini grants are just like, it's just really awesome to be able to have that program. But things like webinar, again, if you're already having a Zoom program and you can get someone to volunteer their expertise time, you can do that. Storytelling, ours are really professional and we do go through a storytelling workshop, but storytelling can be done as simple as you holding a phone or recording over Zoom and using like the free computer video editing. Peer mentorship can be done virtually and through volunteer time without reimbursement. Our Be Informed series is like a very intensive webinar. You can do that sort of thing. Also, if you have a Zoom account already. Same with our learning collaborative. You know, our Be Informed series, we give honoraria to our speakers, and that's great. But you know, if you're a young, scrappy coalition, folks may be willing and will likely be willing to volunteer their time. So you just got to ask. Our learning collaborative, this is like a very intensive hour-and-a-half long every week for 3 weeks to create a big action plan and walk out the door. The funding here is to help them, you know, have that impact on their programs and to pay for their staff time. But you, again, if you are solving a problem that people really want solved, folks might line up to give their time to be part of an expert education. We've built work groups to really bring in outside expertise to tackle issues specifically in these areas with hepatitis B. I just think, you know, working groups within Coalition is a really good way to hone in specific expertise to tackle specific problems without having to spend necessarily everyone's time, or to kind of do a collaboration between Coalition and outside consultants. And then material creation. Again, this differs all over, but you know, this is one of those things where we have a little bit of money to spend to help kind of publish and get it out to others. But if you have time and you can use things free like Canva, you're able to build some of the materials you need. So I went over my time a little bit, sorry. Like I said, I get excited about this stuff. I'm happy to answer questions, and I'm going to turn it over to Chibo and who will talk about something else that Hep B United was able to have a good impact on. So take it away, Chibo.
Thanks so much, Frank. And I'll just wait a little bit for Shreya to share the slides. And I just wanted to, I think one of the things I really appreciated about hearing your background, Frank, and the background of Hep B United is truly, I think the fact that like we're all organizers, or that you started with as an organizer, and I did too. And so that's definitely at the heart of the work and the heart of what we do here. And so I think that's definitely very impactful. So I'm really excited to talk about the Tuberculosis Elimination Alliance, also known as T. We were actually modeled, T shadowed and learned from the great, I think, lessons learned from Hep B United. And so you'll see actually quite a lot of similarities as I talk about our program and our coalition building work. Next slide. So I'm here today to talk a bit more about the overview and origin story of the TB Elimination Alliance. Next slide. T started as a call to raise awareness about TB, tuberculosis, and the case rates in the Asian community. And so we have some notable, data about in 2017, TB disease was reported in 3,254 Asians in the United States, accounting for nearly 36% of all cases reported with TB nationally. TB has the highest burden in the top 4 countries among non-US born Asians. And this was in 2017. Next slide. In 2020 to 2022 and to currently, we see incidents increasing. Not only in Asians, but also in African Americans, US born African Americans, and non-US born Latino Americans, and Native Hawaiians and other Pacific Islanders. The TB burden is very much health disparity and impacts many of our folks of color in the United States and also in the affiliated Pacific Islands as well. Next slide. So as we're talking about coalition building, I think it's really important to show to you and Compliments to Maria Gutierrez, who was with the forum for a lot of the designing of these slides. But just wanted to kind of share that, you know, the TB Elimination Alliance was formerly known as the TB Community Engagement Network. And it was founded as a call to address the issue of Asians in the high case rates of Asians and Native Hawaiians and Pacific Islanders impacted by tuberculosis and latent TB infection. And so in 2019, we started out with a planning phase. And then all the way up into 2020, a coalition building, and then 2021, our mini grant program, and then our 2022 elimination champions and our expansion goals. So I'm going to go into a little bit more detail here. Next slide. So we were founded as 4 organizations, steering committee partners. At the time, we were called the LTBI Network, the Community Engagement Network, Asian Pacific Islander American Health Forum as one of our partners, AAPCHO, Hepatitis B Foundation, and Hep B United, and then Stop TB USA. AAPCHO is the Association of Asian Pacific Community Health Organizations, and we were formed to create a national voice to advocate for the unique and diverse health needs of Asian Americans and Native Hawaiians and Pacific Islander communities, and the community health providers that serve their needs. Through AAPCHO, our mission is dedicated to promoting advocacy, collaboration, and leadership, and that improves the health status and access of Asian Americans and Native Hawaiian Pacific Islanders within the U.S., the U.S. territories, and the freely associated states. My role at AAPCHO is I am a senior program manager of infectious disease at AAPCHO, and so I have the honor of getting to work with the TB Elimination Alliance on a lot of our programmatic goals. And in addition to that, also on COVID and other Hep B priorities. And so we have a lot of wonderful, I think, important lessons learned that we get from Hep B and working with the Hep B Foundation and Hep B United, and that has definitely been useful as we build our TB Elimination Alliance coalition. Next slide. Asian Pacific Islander American Health Forum influences the policy, mobilizes communities, and strengthens programs. And they were founded in 1986 with headquarters in Oakland and their policy office in DC. And they provide grants, training, technical assistance, and consulting so that communities can mobilize and grow stronger in their coalitions and organizational structures. Next slide. And of course, I wanted to share a bit more about Hep B United, but you already have learned, very much a lot of, I think, the work that Frank was sharing about Hep B United and this national campaign. But you'll see a lot of parallels in the work of how Hep B United was created, and that's because it was co-founded by both Hep B Foundation and AAPCHO. And a lot of the coalition building work and the ways that we engage with our members and our partners is crucial in the ways that I think we, think about our strategic goals for the TB Elimination Alliance. There's a lot of syndemic and many parallels in the disparities, and so we lean a lot on the successes and I think promising practices of the Hep B United. Hep B United, very much is voices for the local and national advocacy, and that is something that as T we also aim for. Next slide. So, I think Frank had shared some of the latest data that you have on the significance of your programs. This was back in 2019 when we were first starting out and thinking about the planning for the TB Elimination Alliance. And so in our planning phase, we're looking at the strengths of these organizations, AAPCHO, Asian Pacific Islander American Health Forum, Stop TB USA, and Hep B United. And so we were like, wow, Hep B United has, mini grants, a mini grant program, a whole model of mini grants that have been able to provide this kind of funding for these community-based organizations. And mentorship, monthly webinars, a summit that happened to share best practices and to do convenings with our partners, and also to provide these collaborative opportunities of advocacy and policy. So a lot of this vision of the TB Elimination Alliance was sort of, in that kind of diagram. It was really, a coalition building approach. Next slide. So again, looking at this diagram here, we, just the idea that we all want to come together and build, I think, awareness and education to really address and to see how we can support our communities, right, that are most impacted. And so AAPCHO, the Forum, Hepatitis B Foundation, and Stop TB USA, we came together, we formed this network. And the network eventually became the TB Elimination Alliance. Next slide. And just wanted to share a bit more about our different roles with the Forum as the lead of the project back in 2019. They support with a lot of the grant management and liaison with the CDC. We are funded by the Division of Tuberculosis Elimination at the CDC. And at AAPCHO, our role, and my role working at AAPCHO and with my colleague Dia, we build a national community engagement network and also several of our other AAPCHO members that are heavily involved with key and staff. So we build a network. We serve as the liaison to network members, and we connect members with technical assistance and training and manage the mini grant program. With Hep B Foundation, we lean on their technical assistance and training to build partnership and capacity with top target populations. And we also, in the past couple of years, we hosted an annual TB and Hep B joint summit, which I think many of you were able to be a part of. And with Stop TB USA, we lean on their subject matter expertise, specifically to really, I think, engage, mobilize, and build advocacy in the TB space with our partners. Next slide. And so at AAPCHO, I just wanted to kind of go back and I know I'm just sort of, it's tricky to talk about, I think, the TB Elimination Alliance without really focusing on how these 4 organizations built this coalition, right? So, at AAPCHO, our focus, our strategic goals are really increasing access to care, improving health outcomes, and promoting health equity. And so we do this by addressing the health disparities of Asians, Asian Americans, Native Hawaiians, and Pacific Islanders. And so we do this through 3 of our programs in diabetes prevention and management, hepatitis B, and TB. And then also in some of our other areas of work too, in our training and technical assistance. And that spans from the workforce to disaggregated data for Asians, Asian Americans, Native Hawaiians, and Pacific Islanders, to the importance of inclusivity and structural and cultural humility. Next slide. So going back to this diagram, I always like to look at this to just think about like where we started, where we're going to, and just like how much this, the TB Elimination Alliance has developed and changed over time, and the lessons that we've learned, but just through creating this, but also the lessons that we've learned from our partners and all of the members and the people that have made up the TB Elimination Alliance. It's not just these 4 organizations. It's actually, it's really beautiful to quite see how the coalition has become more of a movement, really, to address TB and TB infection. And it has really developed and changed over time from 2019 to up until next year. So next year will be the last year of our current cycle. Next slide. So we formed, through the process of, I think, in 2019, the planning phase of really gathering ideas and going through a strategic planning process, building our goals. We did a lot of branding as well. And from the TB Community Engagement Network, or known as TB-CEN, we formed the TB Elimination Alliance and launched the branding of T We have a website, which my colleague Dia can share in the chat of the TB Elimination Alliance. You can check out more about our different resources, but starting really in, I would say 2021 was where we were able to launch our website, launch our branding, and then in addition to that, get our mini grant programs up and running, and really just so exciting. And I can't wait to share with you all the impact of this coalition building work. Next slide. So we developed our mission and our vision statement. So mission, we are a national partnership of community leaders dedicated to eliminating TB and LTBI inequities among Asian American, Native Hawaiian, Pacific Islander populations. Our 3 areas of priority are education, raising awareness, and innovation. And our vision is healthy communities free of tuberculosis. Next slide. Our strategic plan pillars are collaboration and partnership, community engagement, access to testing and treatment, provider education, research, and data. Next slide. And again, going back to our 4 pillars, we want to share resources and best practices or promising practices. We want to develop partnerships to scale existing initiatives. We want to conduct outreach to the most underserved populations with the highest TB burden. And we want to increase awareness and understanding of culturally and linguistically appropriate LTBI TB testing and treatment strategies. Again, we lean a lot on the expertise of those four steering committee partners that helped found the TB Elimination Alliance and our members and this national movement. And also very much a major appreciation to Hep B Foundation, Hep B United for helping guide us as we build this alliance. Next slide. All right, so how do we continue to build our team membership? Next slide, please. I wanted to just share a little bit more about some of the benefits of becoming a team member and requirements. So benefits are that we have monthly meetings with our local partners and our steering committee. And this is an opportunity to share different events, different opportunities, the latest data, and also anything that we want to uplift about T, and whether that is through our mini grant program, our summit, and the other training and technical assistance opportunities that we provide. We have a strategic plan that is guiding us through our work that we also, helps us to focus on our collaboration and partnerships, our community engagement, and our access to testing and treatment, provider education, research, and data. We do an annual national audience webinar and learning collaborative, similarly to Hep B, and we have access to subject matter experts who can really help shape some guidance on how you want to work on your TB programs. And how you want to also connect with your TB partners. And then we do an annual TB Elimination Alliance Summit, and we offer a mini grant program. So to become a team member, my colleague can share, Via can share in the chat. I think it's a membership contact form. I think it's a SurveyMonkey link. And I can also share about that afterwards. And the requirements are that we, similarly to Hep B, we really want folks to be working directly with organizations in the US and US territories that serve Asian Americans and Native Hawaiians and Pacific Islander communities. But in the past year, last year and this coming year, we focus on the expansion as we move towards health equity approaches. And so that's looking at not expanding to non-US born Latino American communities and US born African American communities. Our priority for membership are community-based organizations and community health centers, and applications for our membership are similarly, I do an interview with folks and check in with them about their interests. And then I also share at the steering committee, and decisions are reviewed quarterly. Next slide. I wanted to share with you some of our local partners and our team members. And so as you can see, we have local state coalitions, academic institutions, community health centers, CBOs, and state, city, county health agencies that span everywhere. And we're very thankful for their leadership and partnership. Next slide. All right. how we operate with a national focus through supporting local organizations and partners. Next slide. We do this by our partnerships and our collaboration. So we offer webinars, different trainings and technical assistance. Next slide. And also our mini grant program. And so from 2019 up until currently, we actually have been able to provide over $500,000 of T-Mini grant funding to over 30 unduplicated organizations. Next slide. And as you can see here, you know, a lot of our funding has been distributed by both different types of funding have been focused on outreach and engagement, screening, staffing, and also being able to provide this funding from people who do these amazing public health TB elimination projects in their communities. And the ultimate goal of these projects and mini grant funding projects are to really support and partner with your local public health organizations. Next slide. And our total reach from 2020 and 2021 has been 4,420 individuals. So that ranges from community members to general public, to the TB, LTBI patients, and healthcare providers. So that shows the impact and significance of how we have this national alliance, but we're doing it locally. We're also partnering. We're building that coalition. Next slide. And I don't have too much time to get into this, but we will share the slides afterwards. I want to just share with you some example activities of the work that we've been able to do. Next slide. And some of the barriers as well. This program launched during pandemic time. We're still in the pandemic. We're still, and it is, this year was the first year that we were able to do in person. You know, we were able to meet in person. And so I can't wait to share with you all the photos. And but yeah, there are definitely a lot of barriers related to, you know, TB elimination. And that is, you know, COVID, stigma, diagnostic, and also retention, particularly with the workforce, which I think I know that many of the folks in this room quite understand. Next slide. Wanted to share an example of our community outreach event, and just really exciting to show the pictures of folks in the community doing education and awareness about TB and TB infection. Next slide. And finally, I just want to go through quickly our goals through capacity building and advocacy. Next slide. So we have 5 goals, and these 5 goals are our year 5 and year 6 expansion goals. Our vision is healthy communities free of TB, and we really are focusing on how important it is to approach what it means to be partnering and coalition building with organizations and expanding to further populations to reach health equity goals in TB and Hep B. And so we're appreciative that we're able to lean on Hep B Foundation, Hep B United's expertise, and our steering committee and our member partners to develop these goals that we have for this upcoming year. Next slide. And finally, I wanted to share just some pictures of our coalition building work. As I shared earlier, we were able to meet all together in person for the first time. And so we just came back from our national TB conference. And I just love that actually the theme of that conference was the partnership, innovation, and equity. And I think that's a really great way for me to sum up a lot of our coalition building work here. You'll see here in this picture on the main picture here, a lot of our mini grantees and some of our steering committee partners. And then in addition to the photos on the right, you'll see Frank over there and our colleagues both at the Asian Pacific Islander American Health Forum, at the CDC, and AAPCHO. And thank you very much. I will bring it back to Shreya.
Thank you so much, Frank. Thank you so much, Chibo. Before we move into question and answer session, If you have questions about Hep B United membership or want to become a member, please feel free to reach out to myself or Frank. If you have questions about TB Elimination Alliance membership or have questions, please reach out to Chibo or Dia. It'll be great if Dia or you can drop your emails to the chat. My first question to you is, doing the work that you do or the resources you provide to partner organization, how big of a role does policy play? And Frank, if you could start.
Oh, that's a great question. And actually a really good one to discuss because much of the work that we all do here, whatever the goal is that we're trying to solve, there is likely some component that interacts with a policymaker, like a law or something, or is being funded by a city, a county, a state, federal funding. And with that funding comes rules. So very much Hep B United and the initial funding with HHS, and then actually even now through our funding with CDC, the pieces that we're having them fund and the pieces we are really using their dollars for have a pretty strict wall, a very strict wall, I should say, between our policy and advocacy work and what that work it can be funded by, and that is that is federal law. Like we would be in big trouble. And so when it comes to when members join, I think for the most part is not it has not been our advocacy work or our policy work, and it did not begin that way either. Really where our advocacy and policy strength has come is that all of these individuals who are very passionate about solving the problem of hepatitis B in their communities have gone and done all the great work on all the other pieces. Like they're working to implement the vaccine recommendations, they're working to implement the testing recommendations and this, that, and the other, but they recognize also that there is a great need for something. And so they also put their time toward advocating to be able to access that something. I'm trying to be very vague here because I don't want to run afoul of any rules. And we help guide them on that aspect, and we give them opportunities for that as well. So I think that it is an important part of the work we do, but I do not think, in fact, it is what drives people to us in terms of membership. I think it is, in fact, like a bonus of membership, should you choose to engage it. And not everyone does. And in fact, much like how we're limited on what we're able to do with it, we have members who very much don't engage with our advocacy efforts because they're in a publicly funded or some other role. So we work hard to kind of keep that separated, and it does play an important part, but we have to be very mindful of it. And I would say, though, that others should also be really mindful of it when applying for grant funding. So just grant funding is great, but just make sure when you're doing that, that you're not going to accidentally hamstring yourself somehow. So great question. Chibo.
No, I would have to agree. It's similar in TB and with T that there's a lot of, I think, different. Yeah, when it comes to policy and advocacy, it really depends on each organization and their restrictions or availabilities. But one thing that I really appreciate about T and T's like movement in this movement and going back to this idea is that we are able to be this like national voice in some way. Whether that is, I think promoting policy through education or through, I think through AAPCHO, a lot of that is our mission is to really focus on the advocacy piece and that collaboration and policy piece. But I will say, as a member, going back to what Frank shared, it's definitely a bonus. But it is also quite complex too, and it's dependent on each organization's own restrictions, or as a organization or individual that is a part of the TB Elimination Alliance. So yeah, I hope that kind of answers it, Shreya and Frank.
Oh, yeah, I love what you've added, and I was going to add on to something that you just made me think about, in that like we just asked a question and answered a question about policy and advocacy without actually framing technically what advocacy is. And this is where it extra gets sticky, because I can say the following statement, which is a factual statement, and that is, Hepatitis B is the #1 infectious disease in the world, impacted or with more than 300 million people living with the disease. And in the United States, more than a third of individuals living with the disease are unaware of that. We also have low vaccination uptake among adults, which means what we do know about the disease is a conservative estimate, period. Like, that is factual based on important thingies. I can say that to a wide audience of people and it be okay. But if I say that statement to a member of Congress, I'm still okay because I'm educating. But if I at all say then a number, like a budget number, or like we need X or whatever else, like a call to act, just that one sentence can change it from being education to crossing the line to advocacy. And that's where it gets tough because we're working in kind of that white hat space where it's like everything we say that's a fact sounds like we're making a plea, and that's because we're in a tight space. But there's a way to deliver factual bad news in a way that doesn't run afoul of like the advocating language.
Thank you for that. We do have a couple of questions come in through the question and answer space. First question, how do you keep your members engaged and invested with monthly meetings? Do you provide stipends, compensation for involvement? Chibo, I'll let you go first.
Yeah, it's such a great question. So for my team, we the way that we keep our members engaged is by doing some regular check-ins too. And so, it's always important to kind of have that personal, I think just individual check-in. So reaching out to folks and just making sure that you're communicating and following up, providing the notes, providing the slides, like recording, so that people have all those resources available to them. I think what I have really appreciated about T is we have like a well-oiled machine in some way where I can really trust, similarly to I think how Frank and Shreya are. I'm like very much like appreciative of my colleague Dia because we're a well-oiled machine in the sense that like we have a system going where we do really make sure we respond to people. We make sure that they have the information that they need, that people get the reminders. Reminders are super important. In terms of incentives, I wouldn't say we have financial incentive, but it's the other kind of incentive of knowing that you're contributing to this network and this alliance, right? That's passionate about raising awareness in our communities, and passionate about promoting advocacy for people that are the most vulnerable. And that is an incentive that I think is truly reflective of the membership. And I'm very appreciative of that.
Yeah, I think actually, so there's not a financial incentive, but I think one of the, I go to the T membership meetings, and T as well as the Hep B United Coalition calls. There are two aspects to them every month that as long as those two things happen, it makes sure that meeting isn't just another meeting. And I think that's what makes it really important. It's like you have a monthly coalition call that isn't just another coalition call. It is like folks expect something coming out of it. So the first thing they expect is that there's going to be that 15-ish minute presentation from an outside expert on something, or like an internal person presenting on something. Like there is going to be like knowledge distributed in some way, shape, or form. And sometimes it's us talking about like how to apply to our mini grant program for the year, or the launch of an internal capacity building. And that's important because it's an opportunity for them, our partners, to answer, to get their questions answered. But then there's also where some of our recent examples is we bring in a partner of ours to present on something they've recently done. And so we had two individuals, and actually I see that Ben Trans here, from Ben Trans organization, the Asia Pacific Health Foundation, present on their Train the Trainer module and ask folks to use it, both so they could get direct feedback on their training, and to also like stress test their system a little bit. And they came in kind of asking, like, hey, can we kind of do this? We're like, oh yeah, please help us cover this 15 minutes. That'd be great. And the rest of the partners were blown away by the conversation. I mean, it was such a spectacular presentation, and it left folks being like, oh my gosh, we can do this in our place. And that wasn't even the outcome we were trying to go for. We were trying to like help out APHF get the information they needed, and it ended up going farther than that. The second thing that I see in both of these coalition monthly calls is that this is that time, the expectation of this is that time where best practice is going to be shared in general. So we do our webinars and everything else, and there's often these Q&As and other pieces where folks can like pick brains and get individualized answers. But the coalition call is very much a time for, like, we have a chunk of time set aside for partner updates, and folks will talk about like what they're doing, but a lot of times they talk about the problem they're having or the thing they ran into, or it'll just be like, hey, I had this happen. Has this happened to anyone else? And like just that validation they're not alone, or like the, hey, I am alone, like helps them and others adjust accordingly. And so I think those are the two biggest like why folks show up. I will say, I don't think we actually talked about this at all. We survey our members every year, plus like a whole bunch of other questioning throughout the year, but we like hardcore survey our partners every year to ask like how what we're doing is working, how what we're doing isn't working, what they need. And I've seen, you know, in the last several years, and especially over this last year, on the like survey I put together and got the responses for, you know, why people liked our coalition calls, and that was like it's those pieces. What else we got, Shreya?
Thank you. We have one more question, and that is, on your team membership and requirements, you listed US-born African American. Do you consider non-US-born African immigrant communities? Frank?
Yeah, I think.
Or Chibo, whoever.
So I think that was on our team membership. And yeah, we are inclusive for sure to both non-US born and US born. That's the particular language that we, I think, need to state in terms of our expanded populations, but in terms of our membership, it is inclusive. So I would, the only thing is we do want to make sure that our members are in the US and the US affiliated Pacific Islands and the freely associated states. And so it's important that you're from an organization that can serve those expanded populations, those additional populations, but has to be based in the US.
Frank?
Yeah, and I'll say we are actively trying to expand our membership in the African immigrant serving communities. So very much, if you are a US-based coalition focusing in those communities and wish to get connected to what we're doing around Hep B or expand your Hep B work, come talk to us.
Thank you both. I think we do have time for one more question, and this is actually my question. So I wanted to ask, is there a cap to the number of members you have for your coalitions? Chibo.
No, I don't. I would say there isn't a cap to the number of folks in our TB membership or TB membership. So I'd encourage folks to apply. We'd love for you to be a part of our, TB Elimination Alliance, and also to, apply and support Hep B United and as well.
No, not a limit to our membership. And in fact, even if you don't quite meet the membership requirements yet, come connect with us still. And we've helped folks build themselves into a place that they can become official members. Additionally, I see here in the Q&A from a Mr. Anthony around regional or community organizations acquiring funding to support hepatitis activities. And I actually want to flag that our mini grants program is available to more than just our members. Our members, which are coalitions, their members can apply to our mini grant program. So if you are part of if you're a community organization that is part of a coalition that is an HBU member, yes, please come apply to our mini grant program. You have you have 5 weeks to still get your application in. Come talk to us. We'll happily help you get your application in, and then we will see where we go from there. And with that, I think we are wrapped up. Shreya.
Yes, thank you so much, everybody, for attending. We'll follow up with slides and recording. And if you have any questions for Chibo or Frank, please feel free to reach out to me or them directly, and I'll make sure they receive your questions. We also have a survey. Once you're done, screen will pop off with survey questions. Please fill that out. That helps us improve on our next webinars. Again, it's been a pleasure hosting today's webinar, and thank you so much for attending. I hope you all have a great day. Thank you. Bye, everyone.
Thank you.